It's a tough one, but a lot of progress has been made. I want to provide an update to our people, to our citizens, to the world, frankly, on our action to address the coronavirus and those that have been hurt badly by it. At this moment, we have 22 patients in the United States currently that have coronavirus. Unfortunately, one person passed away overnight. She was a wonderful woman, a medically high-risk patient in her late 50s. 4 others are very ill. Thankfully, 15 are either recovered fully or they're well on their way to recovery. And in all cases, they've been let go and they're home. Additional cases in the United States are likely, but healthy individuals should be able to fully recover. And we think that will be a statement that we can make with great surety now that we've gotten familiar with this problem. They should be able to recover should they contract the virus. So healthy people, if you're healthy, you will probably go through a process and you'll be fine. Since the early stages of the foreign outbreak, my administration has taken the most aggressive action in modern history to confront the spread of this disease. We moved very early. That was one of the decisions we made that really turned out to be a lifesaver in a sense, big lifesaver. On January 31st, I imposed travel restrictions on foreign nations who had, and anybody that had been to China or people coming out of China. And I want to say that China seems to be making tremendous progress. Their numbers are way down, and if you read Tim Cook of Apple said that they're now in full operation again in China. Their numbers are way down. Experts now agree that the decision to move so quickly, despite a lot of opposition on that decision, was a wise one. It greatly slowed the spread of the virus to the United States, and it really gave us time to do some of the critical moves that we've done. And it allowed these great professionals to get together and figure it all out. And we think they've done that. We've taken the most aggressive actions to confront the coronavirus. They are the most aggressive taken by any country. And we're the #1 travel destination anywhere in the world, yet we have far fewer cases of the disease than even countries with much less travel or a much smaller population. As an important part of our efforts, on Monday I'll be meeting with the largest pharmaceutical companies in the world, actually. They'll be coming to the White House, and we're talking about a vaccine and developing very quickly, and they've already started working on it, developing very rapidly a vaccine for the virus, to combat the virus. And we're having very good initial feedback. But these companies will be coming to the White House on Monday. Tremendous amounts of supplies are already on hand. We have 43 million masks, which is far more than anyone would have assumed we could have had so quickly. And a lot more are coming. Today, the White House Coronavirus Task Force, led by Vice President Mike Pence, they met for 2.5 hours. I spent a lot of that time with them also, and we came up with some ideas, recommendations, and frankly, some pretty strict edicts that we're going to be going by, and Mike's going to be discussing that. But we are really having a group of people that is so talented, and they're working round the clock. And for that reason, I really would wish that we could report exactly what's happened, how well we're doing under quite adverse circumstances. But we're doing really well. very, very professionally handled. Our country is prepared for any circumstance. We hope it's not going to be a major circumstance. It'll be a smaller circumstance, but whatever the circumstance is, we're prepared. And I'd like to just ask and caution that the media, we would respectfully ask the media and politicians and everybody else involved not do anything to incite a panic, because there's no reason to panic at all. This is something that is being handled professionally. I also want to thank, by the way, governors and representatives of our various states, in some cases some more than others, because they've really been working very hard in areas where we've seen indication of the virus. But I want to thank the governors and all of the representatives from all of our states, the rooms they've made available, the speed with which they've worked has really been incredible.
The task force met this morning and brought the President a range of options, and at his direction, we will be doing the following. First, the President authorized action today to add additional travel restrictions on Iran. We will be using Section 212F, banning travel from Iran. Iran is also already under a travel ban, but we are expanding existing travel restrictions to include any foreign national who has visited Iran within the last 14 days. In addition to moving Iran, we are going to increase to the highest level of advisory, which is level 4, advising Americans do not travel to specific regions in Italy and South Korea. Let me say again, the President today has authorized the State Department to increase the travel advisory for Americans to level 4. We are urging Americans to not travel to the areas in Italy and the areas in South Korea that are most affected by the coronavirus. The President's also directed the State Department to work with our allies in Italy and in South Korea to coordinate a screening, a medical screening, in their countries of any individuals that are coming in to the United States of America. And we look forward to working with them in a collaborative and a cooperative way.
Mr. President, real quick, if I could just ask you said the other day in the cabinet room with African-American leaders, you've got to get away from politics. You were down in Charleston last night using the word hoax when talking about Democrats. Somebody now is dead from this. Do you regret that kind of talk?
No. Hoax referring to the action that they take to try and pin this on somebody, because we've done such a good job. The hoax is on them. I'm not talking about what's happening here. I'm talking what they're doing. That's the hoax. That's just a continuation of the hoax, whether it's the impeachment hoax or the Russia hoax. This is what I'm talking about. Certainly not referring to this. How could anybody refer to this? This is very serious stuff. But the way they refer to it, because these people have done such an incredible job, and I don't like it when they are criticizing these people, and that's the hoax. That's what I'm talking about.
What responsibility do you feel, as you're communicating about this, for the public to follow your directions and to take the prudent steps? And then when you did use the word hoax, couldn't that cause some people to not take the precautionary steps because they're linking what you're saying when you use the word hoax in the context of coronavirus?
Okay, so again, the hoax was used with respect to Democrats and what they were saying. It was a hoax, what they were saying, and that was very clear if you'd read the words, and I think you know that too. As far as what responsibility, my great responsibility, I think the biggest decision we made was going very early, and that was a decision made against a lot of people that thought we shouldn't do that. That's why we're at 22 instead of a much higher number. It would have been a much higher number. That was a big decision. It was a hard decision because it had never been done before anyway. I mean, not even early or late. It had never been made a decision like that. So that was big. And my next thing is really getting the best people. We're the best people in the world. They're standing behind me. These people are so talented. I've seen them in action now for a number of weeks, actually, but in particular for the last 4 or 5 days. And I want to thank Mike Pence and everybody for the job they're doing. We have a great team. We have great people. And this too will end.
Are there
Whoops. Yeah, the case, again, this is why we're talking about the community cases with no link to travel. So the investigation at this time shows no evidence of link to travel or a known contact.
Okay, and also you said that Americans as a whole are at a low risk. Are Americans on the west coast of the United States at a low risk? And are you considering restricting travel within the United States?
So I just want to emphasize again that the Americans, independent of where they live in this nation, are at low risk, all right? And we're going to continue to evaluate aggressively these on-link cases as we see them. And as we learned, we'll obviously communicate that.